Hi, and welcome to the Holistic GP podcast. This week we are speaking to Dr. Andrew Bradbeer. He's the director of Mansay Medical, a busy clinical practice that specializes in respiratory and sleep disorders. He completed his specialist training at St. Vincent's Hospital and Monash Medical Centre in Melbourne before working with the team at the Royal Brompton Hospital in London. Now, his clinical interests range from acute respiratory disorders and to all aspects of sleep disorders too. So let's welcome Dr. Andrew Bradbeer here today to talk to us more about sleep issues in adults. Hi, Dr. Andrew.
Hi, Dr. Ashwini. Thank you for having me along. It's good to meet you and good to have the opportunity to talk about this stuff.
Thanks. Sleep is a big issue in general practice for us. So getting a sleep physician in is definitely here to answer all the questions that we often get from patients. So I thought of getting started. Do you want to give us an introduction about yourself and how you got into this field?
Yeah, sure. I work in Victoria. My base is in regional Victoria. I have a practice that spans a number of towns, and when I began as a specialist nearly 20 years ago, I expected that sleep would be such a major part of my practice, but I did train in sleep medicine. My colleagues in regional Victoria, many of them GPs, were desperate for some help in managing patients with. A lot of whom were having to travel a long way to see specialists in the city. So we began to develop services for patients with sleep disorders in regional Victoria, and telehealth and the kind of acceptance of telehealth by people. Our practice now extends well beyond regional Victoria to as well. So I really enjoy looking after people with sleep disorders, often because we can make a really big quality of life. Sometimes diagnosing and treating a sleep problem. Sometimes just offering some pretty simple advice that really makes it.
Now, one of the main things I feel now we are dealing with, especially in general practice, is stress and insomnia. And and we know there's a lot of reasons there and how the cortisol works and how it affects our sleep cycle. Can you just give us a bit of insight into this area of medicine, stress and insomnia?
Yeah, so there's a vicious spiral that people can get into with stress and insomnia. No doubt many listeners will have experienced that, and you'd see that with patients on a daily basis. So there can be an adaptive response there if you're in an environment where it is unsafe to your body just, and that's something that happens to protect us from danger in some situations, although not in danger, thankfully, in our beds by night, but a lot of time it just seems like we can't sleep because of a kind of good stress, say that's been unwell or a family member, or you might have had some illness. A number of for a little while made it difficult for you to sleep because you were stressed, and that I think that is a great increase in anxiety across the community, disorders particularly, and people experience often, and even young people, and we do have increased cortisol and increased adrenaline, the kind of hormone go up when we are acutely stressed. And they're just up a little bit all the time, and they make it physical to sleep. One of the things that I realise when people come to see me is that often come in the issue with stress or anxiety, and their expectation is that we need to fix that if we sleep better, and often that's not what we need to fix. Often there's a consequence impacting on their sleep that then kind of perpetuate poor sleep into bad habits, sleeping, so they just lie in bed awake for a long time, and then they start before the place where they do most of their deep thinking. It's not where they go to sleep anymore, and that's a try to unwind or to get people out of, or they might have gotten into a sleep box, become accustomed to that, and we need to do some work on their body clock to help a bit better. There's a number of other things that we can do to improve people's sleep when the trigger to pull. Once we're able to help them sleep better, often we're able to address the anxiety as well.
So from your experience, so what are the strategies we can work with when we are stressed? I mean, the mind is going, that's a big thing there. But what are the realistic things that we can do to allow us to not get into that cycle?
There's a few things that, there's obviously things that we, in the realm of what psychology. So I tend to tread lightly there. I'm not the best psychologist, although I do point online resources if they want to get deeply into some of what we call cognitive behaviour for insomnia. So that's all. How to think about sleep differently and learning how our behaviours impact on our thinking about sleep. Resources in that space. Things that you can do. So that includes making sure that you're not substances that are going to, including caffeine and nicotine. So often helping people reduce, or just see that maybe that might be possible is quite helpful. If you drink 6 coffees a day, you don't have any after 2. The other really important thing before, not to a lot of time in bed thinking about the things that worry you. So if you are in bed, things that you're anxious about come into your head, it's really important to get out of bed. Necessarily important. Do something else, although that can be helpful for some people. Go and sit through a magazine for a few minutes. It can be helpful for some people to write things down. Or I'm going to get this stuff, I'll put it onto a piece of paper, I'm going to leave it in the kitchen and then go back to bed. But for a lot of enough to get up and walk to the door and go back to bed again, and put themselves back to bed. Physical just communicates to your brain and to your body that it's time to go to sleep now. This is not in bed awake, going to bed to go to sleep. None of these things are all things that people need to persevere with over a few weeks to have an impact. Sorry, you go.
No, sorry, that's okay. No, it just came to my mind. So these are strategies when there's a problem trying to fall asleep. But often I also have this group of patients who come, they can't stay asleep. They're up at 4 a.m. or 3 a.m. And that seemed to be a bigger problem sometimes, because then they're catastrophing about how they're going to be the next day, and and that becomes a cycle. Yep.
So, I don't know how you approach those people, but I think it's very important to decatastrophize the situation, because the reality, unfortunately, is we've had people are more anxious about their sleep as well, I think. So they need to sleep well, because if I sleep better, but actually I'm not sleeping well, and that's terrible. It's actually, you've been living like this, you've got a decent quality of life, you're not too sleepy through the daytime, all of these things, the fact that your sleep is disturbed. So let's get things into perspective. Let's not worry about this as if it's an emergency, but then let's address those people who have what we call maintenance insomnia. They wake up and they don't get back to sleep. Why are you waking up? And then secondly, why are you not able to get back to sleep? That is a little bit the same as for those people who can't get to sleep in the first place. The same strategies can be effective. Guys, just don't for a long time in the middle of the night thinking about things. You need to develop that association with sleep. You do that by not staying in bed if you're not sleeping. But your bedroom as well, there are environmental things that need to be taken into consideration, and often we don't do that as well as doctors. Although I'd have to say, I think the advent of telehealth has helped a bit. To to me from the bedroom, and I can see that actually your bedroom doesn't look like the best place to sleep. It's messy. It's on your bed, you've got pets there, so your pet's jumping up on your bed or scratching at the window in the middle. There's a noisy street out, much light coming in, so we know that keeping your bedroom dark and sort of 50 degrees if possible, all of that, those environmental things make it more worth considering.
Fantastic. I think these are very good tips because I think, like you said, it's the same thing. So they have to really break the cycle, understand why it's happening, learn some strategies, put your worries aside. So these are great things. Thanks for that, Dr. Andrew. Now, the next thing I wanted to ask you is sleep apnea is one of the biggest thing we see in adult. And, that's the commonest thing I feel we refer to sleep physicians. We do a sleep study, the sleep apnea and all of it. From your experience, how can sleep apnea be effectively managed other than all the strategies we have out there? And for those who actually don't want to use a CPAP machine for various reasons, I've got a new partner, I'm not comfortable, I don't want to be associated with this machine. So where is the progress of sleep apnea going forward, and what else is available out there?
Yeah, I think when we talk about important, have the perspective that we're not actually necessarily talking about a disease. It's so common, and it's common amongst people who are healthy. It's just a part of us. It's probably 30% of men will have obstructive sleep apnea that require. So we kind of need to understand the human condition, disease for most people who have it, although some people have really bad sleep breathing. And you need to also have a clear idea with this and with all other sleep disorders about, so people are not going to do it as behavioural change unless they really know what the goal is. And so the goals of usually stop snoring, that's a big motivator. So that's a social issue. We want to help you sleep quiet. We want to help you sleep well, so we want you to feel good when you wake up in the morning and feel energy through the day. We want you not to the night. We want you to be safe, and so we know that untreated severe sleep apnea, motor vehicle accidents, and so that's another goal, particularly for people who are driving for a living. So we want you to we want you to be healthy, and we know that severe sleep apnea is associated with negative health outcomes, heart disease, diabetes, cognitive decline. Now that doesn't apply to every, certainly not to people with more mild or moderate sleep apnea. And so when you advise about their treatment, you need to bear in mind how bad their sleep apnea is and what is the goal. And I think before with CPAP is true, very, very few people come to me saying CPAP machines, that very much. Some do because they've had friends who have had a good experience and because they feel so. But most people, that's the last thing they want me to tell them that they need. So there are other we use. I don't want to talk it down. CPAP is fantastic and transformative for the right person. Nuances getting CPAP treatment right, and so sometimes people have had a bad initial experience of CPAP. The other main treatment for obstructive sleep apnea is something called a mandibular advancement device. So this is a dental plate that's used to help to support the lower jaw and hold it forward slightly while you sleep. So there are two components to this device, one for your upper jaw and one for your lower jaw. And we know that this device is very easy to wear if it's tailored to fit your own teeth. You can purchase these over the counter or online, and they're not particularly tailored, but I would usually advise people to see a dentist to get this fitted up to fit you perfectly, because when you do, it just snaps into place easily, and upwards of 90% of people who have one of these made up are able to wear them comfortably. But they don't tend to work as effectively at the very severe end of the spectrum. over, but they do work in the mild to range for people who have good teeth. It's not all about devices, about modification to lifestyle or to sleeping position. So we see a lot of people whose sleep apnea is only bad because gravity drops the tongue back and they don't breathe very well. And if they can be helped on their side, then they don't need anything else done. So that can be very effective as well. And then there are lifestyle factors to consider. So for some people, managing to lose a bit of weight is a goal, or alcohol can be part of the important advice as well. I want to know whether operations can help, and operations can help with obstructive sleep apnea. There are some operations on the up that reduce the size, particularly, that can be effective in people with obstructive sleep apnea, and some to adjust the structure of the jaw in people with jaw deformity. Sleep apnea is one of the sort of routine considerations that we would discuss with anyone who's just been diagnosed with obstructive sleep apnea.
Okay, thanks for that. I think that's great advice. Like, there's a lot of help out there and it's transformational. You're right, because patients really feel better. We can get their blood pressure down, their moods are better, energy is better. So sometimes it works as the best treatment.
It does. I don't know what your experience is, Ashwini, but often I'll find problems come to me with they have an explanation of why it is that they don't sleep well, or why it is that they feel tired. So they will say it's older, or slept really poorly, or I've worked this shift for years, and those explanations are because people often into what's going on for themselves, but often there is something, and often sleep apnea is that something else. People think, I'm the last person with apnea, I'm fit, healthy, I exercise regularly, I'm slim, and yet treating the sleep apnea can be helpful in improving their sleep, even though there's a bunch of other things that are part of their story that have contributed to their poor sleep.
Yeah, you're right. I think the history is very important, and we often get a lot of insight from there. Now, from your experience, Dr. Andrew, what are the other common sleep issues you see in adults?
So there are probably three that we should touch on. Mm-hmm. The first of those is restless legs syndrome, and I'm sure you would see a lot of that as well. Yeah. Restless leg syndrome is the condition where at the end of the day, when everything's relaxed and you sit down to watch a movie or you take yourself to bed, and then your legs just get jumpy, they just start twitching and moving of their own accord almost. And that can make it really difficult to get to sleep, and it can, if it continues through the night, can disrupt sleep as well. A lot of women will have had experience of restless legs in pregnancy, which can certainly bring that on. And many people have restless legs associated with chronic lower back pain, for example. So that's a big condition that probably affects around about 15% of the community to some extent, and can be addressed in a number of ways. But it's a condition worth thinking about. So restless legs is a big one. Shift work or body clock disorders is a big problem, particularly. I know I think you'll be speaking to a paediatric sleep specialist at some point, but we see amongst teenagers body clock disorders start to emerge quite commonly. It's almost normal for teenagers to want to go to bed late and to sleep in the morning, and that usually corrects. But for some people that continues into adult life. Mm-hmm. And then as you go through life and you have children who disrupt your sleep for a long time, or you work a shift job for a long time, that can also disrupt your sleep by upsetting your body clock. And then the third thing that we would see a lot is not necessarily because feel they sleep badly at night time, but because they're tired and sleeping through the daytime, and there's no obvious explanation for that. Now, I'm bringing that up not because that's common in the community, but because people in that situation often feel hopeless. They feel like their sleep is evaluated, there's no explanation, but I still feel tired and sleepy. They've had their thyroid function checked, their iron levels checked, all their other blood work done, and they're still tired and sleepy, and everybody's scratching their heads. And there are some central primary hypersomnia disorders, so disorders of excessive sleepiness, where the part of your brain that controls sleep just doesn't work the way it should. You just don't feel like waking up, even though you've had plenty of sleep. One of those is called narcolepsy, and that presents in younger people. And those conditions are worth being aware of too. We see them as sleep specialists. They're not hugely common, but people with those problems often take a long time to get to diagnosis, and it can make a terrific difference to them to get diagnosed.
And what are your thoughts on supplements for sleep?
So
magnesium is a common one, and I think there's some studies around magnesium. So
yeah, that was going to be the first one that I was going to mention. I think most sleep specialists would be comfortable telling people to try magnesium for sleep, although the appropriate dosage is a little bit unclear. Magnesium is very, very safe, hardly ever causes any side effects, although it can cause a bit of gut disturbance in some people. And it's also, anecdotally at least, effective for management of restless legs as well. So I think magnesium is okay to try. I think the one thing I would caution people about sleep supplements is that sometimes it's easy to forget that you're on these supplements when you're trying to figure out what else is going on with me. So why is my gut upset? Why am I feeling, a bit funny through the day? Sometimes the supplements can have side effects. The other one that kind of comes under the category of supplement a little bit, well, there's two actually. I think we should probably mention. One is melatonin. So melatonin is available on prescription in Australia for people with shift work sleep disorders or insomnia. It's a private script medication. I think it's also available for kids with autism spectrum disorder, and available in low doses as a supplement. Melatonin is certainly helpful for some people with body clock disorders or insomnia. Certainly helpful in older adults, and it's available over the counter off script now for people over the age of 55. So that's a safe and well-tolerated medication, although it can also cause sleepiness the next day, so it's not entirely benign. And the other a supplement that's becoming more widespread is cannabidiol, so CBD and medical marijuana products, and in low concentration these can be accessed off script as well, in very low concentrations, hemp oil and that kind of thing. There's emerging evidence, I'd have to say it's still a bit unclear in that space, although there is some evidence for medical marijuana products. It's reasonably compelling for management of insomnia, and certainly for some chronic pain problems. It's still an area that there's not a lot of studies in, and some people are using some of those supplements or extracts for management of sleep as well. And I'd just say just keep track of what's going on with your body. Just if you're going to do that, I would not have a strong argument against it, but I would urge you just to carefully assess the impact. Are you really sleeping better? And how are you feeling through the daytime? And when it comes to assessing the impact these days, often people are wearing a sleep monitoring device like a Fitbit. So if you're doing that and you're trying something that might improve your sleep, well, pay attention to the results it's giving you and see if it actually does seem to be improving something in a measurable way.
Now, I just wanted to come back a bit to melatonin, because this is sometimes a question I often have from patients also. Why does it work for some and not for all? Why does it work for a while and doesn't work after a while? And is higher dosage actually better or not?
Yeah, so I'm not sure I have the answer to all of those questions, but so melatonin is a chemical that the brain makes.
Naturally,
might know that. So it makes naturally, and your brain, it circulates around your brain, it circulates in the CSF and helps your body know whether it's time to be awake or to be asleep. And that mechanism is a little bit fragile and can be disrupted just by bad sleep for a long period of time. So I think that melatonin will work well if the cause of insomnia is a breakdown in that mechanism. And there are some salivary tests for measuring melatonin, but we don't tend to use them routinely. It's a little bit hard to know what the real result is, because melatonin levels
fluctuates,
They fluctuate through this 24-hour cycle, and they're different individual to individual. But generally, if insomnia is due to a breakdown of that melatonin system, then melatonin will help. And if it's not, then melatonin won't help. sometimes melatonin doesn't work well because the dosing time is wrong. So you need to take the slow release melatonins need to be taken 1 to 2 hours before bed. They're not
Immediate,
a bedtime medication. Yeah. And the standard melatonin is probably even earlier than that. So the standard release melatonin, if you get it made up by a compounding pharmacist, for example, probably should be taken 3 or 4 hours before bed rather than at bedtime. As to why they work for a while and then stop working, I'll be making up an answer if I tell you why that is.
I think you're right. Like sometimes it's because the underlying issue hasn't been addressed. So, and also might be placebo effect that also can be there.
Yeah,
right?
Yeah. And I think it's overly simplistic to say that sleep difficulties or insomnia are ever due to just one problem. There's always
multifactorial
things
there.
contributing to making it difficult to sleep. And so sometimes when we put someone on something like melatonin, we fix one of the 4 or 5 issues that's disrupting their sleep, and that's enough for a while. But the other things, they ebb and flow as well. So it may be that something else just becomes more prominent, and all of a sudden it's not that the melatonin's not working anymore, it's just that the other things have to be addressed if we're going
Equally,
to help, improve the sleep. Yeah.
So my next question will be about sleeping tablets. I mean, I think there's a lot of stigma around using them, and also there is a lot of issue with unable to weaning people off from sleeping tablets. So as a sleep physician, what's your view on using sleeping tablets when it's needed?
That's right. So the key thing is when it's needed. So I think sleeping tablets are a useful part of the many different tools that we can deploy when someone's suffering from insomnia. And so we've talked about a lot of other things apart from sleeping tablets. And I think that's appropriate to do that. I think that it's appropriate to say, well, we've got these other 5 or 6 things, and also we can think about a sleeping tablet. We know that sleeping tablets are not the most effective treatment for insomnia, and we know that cognitive behavioural therapy for insomnia and psychological strategies are more effective longer term than sleeping tablets. But some people need a sleeping tablet, and I think there's 2 mistakes we can make. On the one hand, with sleeping tablets, we can be too ready to prescribe them, and I think that actually that's the assumption from the health authorities, is that doctors are always too willing to prescribe sleeping tablets. They assume that we're just dealing with a person in a 5-minute appointment and we're just writing them a script for a sleeping tablet. So that is certainly an error to do that. But the other error is to be too anxious about prescribing them as a doctor, to be too reticent to prescribe them. So I would see a lot of patients who are prescribed things like temazepam and they're told only use it for 2 or 3 nights a week maximum. And what that's doing is then training the person to be dependent on that temazepam for 2 or 3 nights a week, and then having 3 or 4 nights that you know are going to be bad because they're not using their sleeping tablet, and they're in a pattern now of continued use of a sleeping tablet that I can guarantee is going to continue forever if we don't change it. So if we're going to change it, then we intervene with something like cognitive behavioural therapy for insomnia, and we use a sleeping tablet to help augment that, but we use it all the time. But the deal is we're going to use this every night, and we're going to use it for a month or 2 as you go through this program of CBTI. And the deal is that if you engage with that, then you'll keep on with this tablet for a while to help you now learn a new habit of sleeping well. And once you're in that new habit, well, then we'll withdraw the medication. So I think on the one extreme we can overprescribe these medications, but on the other extreme we can underprescribe, and through underprescribing we can help people build a dependence on the medication rather than find a strategy that has kind of judicious use of the medication for a medium term that will help them get to a drug-free sleeping future. There is a small minority of patients who need to be on sleeping tablets longer term, and they just do, but that's a real minority, and we need to be clear that that does carry an increased risk of falls in elderly people particularly. We need to be careful about that, and we need to be careful about making sure there's no impact on sleepiness the next day.
Thank you. I think you've given us great tips today. So before we come to the end, I just wanted to ask, what is a sleep physician's favorite sleep hygiene tips? What do you tell your patients?
I tell my patients to value their sleep. So that's the first thing. You're not going to do anything to improve your sleep hygiene unless you want to value your sleep. So I'll tell you that you will be more productive, you'll be happier, you'll be healthier if you sleep well. So how are we going to help you improve your sleep? Make sure that you have a regular wake-up time. That's much more important than a regular bedtime. Make sure that you pay attention to what your body is telling you when you're tired and sleepy and feel like you're ready for bed. Make sure that you minimise exposure to blue light from screens and LED lights in the evenings. If sleep is a problem for you, light your room with lamps, not with LEDs from the ceiling. Maybe use blue light filtering glasses. But perhaps my favourite bit of advice, after telling people to cut back on their coffee a little bit, is to make sure you get some natural daylight exposure in the mornings. And if you can't do that and you're sleeping badly, perhaps consider using an artificial light device to do that, because everybody is a bit scared of blue and green and bright light because we know that at the wrong end of the day it impacts negatively on our sleep. But actually we're built to get outside into sunlight in the morning, and that's a very important part of our body clock. And if we're not doing that, if we're either working indoors all day, or if the first thing you do when you go outside in the morning is put your sunglasses on and keep that light off your eyes, then you're damaging your body clock. Now, of course, that has to be done sensibly. We know sunlight, UV light, is terrible for your skin, and you need to be sun smart. That's a message we've all got very clearly. But actually, a bit of light connecting with your retina helps to tell you when it's time to be awake. And at the end of the day, your brain then better knows when it's time to be asleep. So that's probably my favourite.
Oh, thank you. Those are great tips, especially how important sunlight can be. Okay, so anything else you'd like to share with our listeners today?
No, actually, it's a pleasure to be able to talk to you. I just hope to encourage people to. Well, the thing I would encourage people to do is just, if you're not convinced that sleep is that important, if you think there's too much noise around sleep, I just encourage you to experiment. Just what we know is that if you can prioritise sleep more highly, extend your sleep time just a little bit, just give yourself an extra half an hour of sleep opportunity for a month or so, you'll notice some benefits. And there's just increasing awareness of this amongst high performance athletes and executives, leaders across the world, that sleep improves their quality of life, improves their ability to do the job they want to do and fulfill all of their commitments. And if it's good for AFL athletes and Olympians, then it's good for us all. So just
experience good sleep. Yeah,
experience good sleep.
Okay. Is there anything that's really inspired you that you have read or listened to that you'd like to share with our listeners? Not necessarily regarding sleep, just anything. Yeah.
There's so much. There's so much actually that I could say there. Look, I was almost just building on from, perhaps this is just where my current train of thought is, but I was listening to a leadership podcast the other day with two leaders talking about a book one of them had written. But the first 10 or 15 minutes of the conversation was all about sleep, because they'd both been discovering through the pandemic actually how much sleep improved their ability, reduced their anxiety and improved their ability to be productive. And when I hear something like that, it's almost unbelievable that the claims that people are making, but it's true. So so that was just something that's been on my mind just recently. I was at a conference just the last couple of days, and one of the chaps on the stand that I was talking to was when he found out I was a sleep doctor, he was very, very excited. And some people might know this, but he came over and he started talking about the British boxers at the Olympics, I think it was. Have you heard this story?
No, I've not.
He told me that the British boxing team discovered that their beds in the Olympic Village were too small for their boxers, and they weren't going to sleep well enough, so they got bigger beds for their boxers, and as a consequence, the the British boxers did extremely well at the Olympics. Now I'm not sure about that, but it fits for me. It's just an anecdote that I've heard recently that sort of fits in with the sleep.
With the importance
but I haven't researched that. I haven't Googled that to double check the stats. So I'm sorry about that.
I mean, thanks for coming today. I think you've given us very good insight, and people understand the benefit of sleep, but hearing what can be done and what you can work on, to improve your sleep has been great. Now, where can our listeners find you if they want to know more about what you do? And
yeah, so my practice is called Vance Medical, so they can find us online. We have a website, and they'll find more information about how we help people through that website if they'd like. I'm not sure whether there's going to be show notes, but I won't spell it out for people.
Thanks for that, Dr. Andrew. So it's a pleasure having you today. Thanks for all the tips you've given us, and thanks again for coming to the show.
I hope it's useful for some people. Thanks for having me.
Are we good? What's happening?
Almost just building on from